In tonight's Woman's Doctor, if you have stomach or GI issues, you may just think it's irritable bowel syndrome, but it may be something more than that. 11 News anchor Lacey Griffith sits down with one Baltimore woman and her doctor, and they talk about how she was misdiagnosed and what you should watch out for.
Sarah Schaefer was just a teenager when her stomach issues started.
I used to just have a lot of stomach cramping, especially related with like stress and anxiety, and was diagnosed with IBS and told, manage your stress and everything will be fine.
Sarah says she was also constantly nauseous. She just thought that was normal. This was her life until she realized this wasn't normal.
And I was in my early 20s when I actually collapsed at work with abdominal pain and was found to have an abscess, and that is when I was then diagnosed with Crohn's disease.
Crohn's disease, not irritable bowel syndrome. Once diagnosed with Crohn's, she started seeing Dr. Raymond Cross at Mercy Medical Center.
And unlike irritable bowel syndrome, Crohn's disease causes ulcers in the intestine, and it can cause complications like intestinal blockages or strictures.
Dr. Cross says blood in the stool is also not typical for IBS. Now with a real answer, Sarah says this is when her journey began.
Unfortunately, because I had left it unmanaged for so long, it did require a total of 3 procedures over the course of about 2 years.
So very minimally invasive surgery. So for men, teeny little scar around the belly button. For women, usually around their bikini line, there'll be a little incision with some port scars. Shorter hospital stay, decreased perioperative pain, and rarely do patients need an ileostomy or a stoma. So typically you can't even tell that they had surgery.
After the procedures and with her medicine, Sarah says she's living an even better life at 42 years old than she did as a teen.
But I CrossFit, I run marathons, I cave dive, scuba. I wreck dive with scuba, and yeah, I ran my first ultra this fall with my sister.
Sarah says, make sure to listen to your body, trust your gut, and always advocate for yourself. In Baltimore, I'm Lacey Griffith, WVAL TV 11 News.